It's hard to understand if you're not living in it. It's like you're falling down a well and there's no place to grab a hold of. It's just chaos, yeah. Constant chaos, it feels like crisis. You're in crisis mode all the time.
We tell you the COVID numbers daily, and you've heard the pleas from the doctors. But tonight, we take you to the heart of the situation. We're taking you inside the only ICU in Moses Lake to get an up-close and personal look on what doctors, nurses, and patients are battling with daily.
The government on the brink of a shutdown. However, Congress has passed bills to fund the government through December. So what happens now, and where's the money come from?
In weather, we are tracking rain headed our way late this evening and in the early overnight hours. It's going to get chilly overnight as well. We'll look for a mild day on Friday and again on Saturday and Sunday. All your forecast details coming up.
I've never worried about my children dying, and she got pretty close.
After his daughter was admitted to the ICU due to COVID, one Spokane father is now sleeping in his car to be closer to her. We'll hear from him about the emotional journey he and his family have endured.
Do you know people who don't want to get vaccinated?
In my own family.
Really? What do you say to them?
What I'm going through.
What do you want them to know?
Quit being a knothead.
Well, a COVID patient talks exclusively to KREM2 from inside his Moses Lake hospital room. Good evening, and thank you for joining us for KREM2 News at 6 tonight. I'm Mark Hanrahan.
And I'm Tom Sherry. We begin tonight with an inside look at the Samaritan Health Hospital ICU in Moses Lake. Now, just today, the Grant County Health Department announced 12 more people have died from COVID-19. Here's a closer look at the data. At least 2 of the people who died were in their 30s. 11 had underlying health conditions, but across the board, none of the people who died were fully vaccinated. Only 1 person was partially vaccinated. So this number just highlights how deadly and dangerous this COVID virus really is.
Now doctors and nurses there are caring for an unprecedented number of COVID patients. KREM2's Whitney Ward was offered rare access inside.
Hospitals here in the state of Washington have not declared crisis standards of care like they have in Idaho. But across the board, doctors and nurses tell us, make no mistake, they are absolutely in crisis. And here in Moses Lake at Samaritan Healthcare, it is the only ICU for almost 100 miles in any direction. COVID patients have been arriving here for weeks from dozens of small rural communities. They're ending up here while the small number of dedicated staff are working overtime to try and save them.
It's quiet in the intensive care unit.
She's on a ventilator.
Most of these patients are sedated, many on ventilators.
Imagine trying to take a breath through a straw all the time. We sedate them so that they don't remember it.
Some will not make it.
We've had a lot of deaths.
Shelley Gay is the trauma ICU director at Samaritan Health. She says over the last 4 months, the intensive care unit has been at or even above capacity almost every single day.
It's hard to understand if you're not living in it. It's like you're falling down a well and there's no place to grab a hold of.
The red signs over each door indicate a COVID patient is inside. It's what tells doctors and nurses how to gear up before they go in.
The N95 mask, gown, gloves.
Once inside, they operate as a team.
They are rolling him to get him off his backside to help prevent bed sores. So we do this every 2 hours.
The work is demanding and time-consuming.
But the problem is there's so much COVID here that there's so many beds that are full.
Part of that challenge is also lower vaccination rates in and around Moses Lake. Less than 45% of the Grant County population is considered fully vaccinated, and many of the surrounding counties are also lower than the state average.
Every hospital has been packed, so we are keeping these patients and doing interventions here at Samaritan.
So you're just doing what you can because there isn't always a place for them to go.
Exactly.
And Samaritan Healthcare is the main hospital for all of Grant County. The next closest ICUs are either at Confluence in Wenatchee or Sacred Heart in Spokane, and both of those facilities are also at capacity.
COVID and non-COVID.
Some patients, slightly less critical, will find themselves here, 1 floor down from the ICU in the med-surgical department.
Hello, sir.
Jerry Crossler lives in Ritzville and was diagnosed with COVID 2 weeks ago.
I'm 81 years old. I worry about my breathing all the time.
Do you?
And when it's that difficult, you get a little paranoid.
So you knew something was wrong.
Yes.
He is one of 6 COVID patients at Samaritan considered breakthrough cases, meaning they got sick despite being fully vaccinated.
Were you worried coming to the hospital? I mean, were you a little bit afraid of how serious it could get?
Yes.
What did you worry about?
That it was going to keep getting worse and worse, and I'm going to be one of those that they flip-flop and it ain't going to work and I'm going to die.
Mm-hmm.
Those are the thoughts that go through your head.
That's pretty scary.
Yeah.
What would you say to people who are out in your community in Ritzville or here in Moses Lake who don't want to get vaccinated?
They got to start reading the right sources. They get on social media and they read the people they want to agree with. They don't read who are the best people to read.
Are you glad you got vaccinated?
Oh, I'd be dead right now.
You think so?
Oh, yeah.
Doctors tell Jerry he may be able to go home soon if he continues to improve, and I'm told cases like his are the successes that keep these healthcare workers coming back each day and fighting through the moments that are not so easy.
Those days when we have 2 or 3 people dying in a day, those are hard.
How often are you losing COVID patients in here?
We are losing them a lot more often than we have in the past. Being on a ventilator, not being able to catch your breath is not a pretty way of leaving this world.
What gets you through those hard days?
My family, my team.
Lately, though, the team has been getting smaller.
They can't do it anymore.
People just get burned out.
Staffing shortages have hit hard here.
Everybody here is just taking it day by day.
Emily Eidson is normally a nurse educator, but as COVID cases spiked, especially over the last month, she's been pulled out of the classroom and back onto the front lines in the emergency department and the ICU to fill in where there is no one else.
When you're at work, you kind of have to be on your game. People's lives are on the line, and I think that that's just mentally exhausting.
Where if people do not come in compliance, that they will be discharged.
And they could lose even more as the governor's vaccine mandate for healthcare workers takes effect in just a few weeks.
And they don't want to leave their teammates in the dust with more patients than they can care for, so they try to help out and pick up. But I think that they're just getting more and more kind of tired and maybe a little bit frustration.
What do you think is fueling some of that frustration?
The fact that every day they come to work and it's just as demanding as it was the day before.
But it's not just the hard work and long hours that are taking a toll.
And we have people in our community doubting our abilities, our word, and that we are somehow deceiving them about what's really happening inside these walls.
Dr. Andrea Carter is the top doctor at Samaritan. She's been the chief medical officer for the last 6 years and from the very beginning of this pandemic.
Is it hard for you to come in and day out and to see your profession become so political?
It's hard to see the profession become so political, and it's very hard to know that there's distrust of us out in the community. It's not hard to come to work. The people I work with are wonderful, they're amazing, and it's not hard to come to work with people like that.
But she recognizes the lasting impact COVID is having on the entire system.
And at least a portion of our high census right now is people that had to delay care during the last shutdown because resources were used elsewhere or because we were in quarantine.
So this ripple effect.
So it is very much a ripple effect or a snowball effect, right? It just gets bigger and bigger. It's worrisome because we don't know where it ends and at what point do we finally catch up?
Seems a long way off, doesn't it?
It feels impossible sometimes.
Still, these healthcare workers keep showing up, despite the hardship, despite the unknowns.
They come in and they ask, am I gonna die?
What do you say?
Not if we can help it.
In Moses Lake, Whitney Ward, KREM2 News.
If you would like a link to Whitney's story, just text us the word ICU to 509-448-2000. Now, in the article, we have the full raw interviews with the doctors, nurses, and patients that she talked to. And I hope that people that are on the fence or thought that this wasn't serious during the first wave, I hope that they will look at that and maybe rethink their position and also realize this is a more aggressive virus now.
The Delta variant.
The Delta variant.
Yeah. I think what the gentleman that Whitney spoke with had something really compelling to say. He said, people only look for the information that they agree with. Right. They're looking at the wrong sources. Look, listen to the experts, right? They're the ones on the front line, and they say the best way to avoid dying from COVID is to get vaccinated, right? There we go.
And we know there are breakthrough cases, but that you heard that man say, you know, he's one of the rare cases that goes in, but he said, hey, I know I'd be dead if I hadn't had that vaccine. So again, I'm just one more time just saying to you that to rethink it, especially from the first surge to this new Delta variant. I had a family member that finally came around to that way of thinking. And that was very stressful leading up to that, but hey, fully vaccinated now.
Yeah. One at a time, I guess, right?
Yeah, there we go, I guess.
Right, okay. Well, moving on. Prosecutors have not filed charges against the alleged shooter in this weekend's deadly shooting in Pullman. We explain why that he's free on his charges right now, coming up next.
Plus, later, a man with ALS is able to once again communicate with his family. It's all thanks to the Gleason Institute. We spoke with them about how one twitch of his eyebrow now changes everything.